Hello guys, so this is the second part of our Arteria membri inferioris liberi lecture, and the second part will be dedicated to the Arteria poplitea. So let's go. What do we need to know about the Arteria poplitea? So I hope you remember that everything starts from the inferior border of the canalus adductorius, which is the hiatus adductorius, the whole inside of the tendon. And so the artery will go along the fossa poplitea. And so here we have it. So this is the fossa poplitea, and you can see that the artery will go together with the vena poplitea and the nervus tibialis. And so this bunch of blood vessels and nerves, go together, and so here you can see that the most superficial structure will be the nervus tibialis. Under it goes the vein, and the most deepest structure that will lie and go along the capsule of the knee joint and the boson forms the knee joint is the arteria poplitea. And so this artery in the inferior part of the fossa poplitea will split into two terminal branches, which are arteria tibialis anterior and the arteria tibialis posterior. But so before we will discuss these branches, we need to repeat what forms the arteria, the fossa poplitea again. So here we have this rhomboidal fossa, and so we have two upper margins and two inferior margins, as well as we can see two vertical angles and two horizontal angles. So here we can see that upper medial margin will be bordered with the muscus semitendinosus and muscus semimembranosus. The upper lateral margin forms the muscus biceps femoris, and the inferior margins are made of the caput laterale and caput mediale of the musculus gastrocnemi, right? And so here we have this rhomboidal fossa. This is the borders of the fossa, and so what lie inside of it? So we did discuss. We have the artery that will lie basically on the bones and the capsula of the knee joint. Then so the arteria poplitea, then will go the vein, and so the most superficial will be the nervus tibialis. And so this is it, what you need to know right now about the fossa poplitea. And so this region also is covered with the fascia poplitea, so with the fascia. Okay, then so about the terminal branches as well as the side branches of the arteria poplitea. So here again we can see the artery itself, so we can see the start point and we can see the terminal spot. And so here you can see how does this artery posteriorly, right, will split into two terminal branches. We can see that the artery bifurcate into two branches, into the arteria tibialis anterior and into the arteria tibialis posterior. That will also will have a lot of side branches that we will discuss in the third part, right? So this is the artery itself, so with the terminal branches, and so you can see how many branches or side branches this artery gives. And so predominantly the arteria poplitea with all of these side branches will supply the knee joint. So these branches will form the rete articulare genum. And so here we will have two superior, two inferior arteries, and so here we are. So here we have two superior, two inferior arteries that will grab the the edges of the bones, curves, and grab the edges, and so participate into the formation of the rete articulare genum, and one specific artery that will go inside. So in general we have these four branches, and so the last branches are the arterias suralis, and you can see so these arteries will go to supply the parts of the muscus tricepsura. And so let's take a look at these branches. So the first pair of branches are the arteria superior medialis et lateralis genus. So here we have the lateral and here we have the medial branch. So you can see from the arteria poplitea they go from the posterior surface to the anterior, and so they grab the condylus lateralis et medialis femoris, right? So here they are, and this is it. So they grab it and participate into the connection. So you can see these branches split into the smaller and smaller branches to supply and participate into this arterial web formation. And so also we have another schematical picture like here. Yeah, you can see the the medial and the lateral superior arteries, arteria superior medialis et lateralis genus. Yeah. Okay, then we have the inferior branches, though the idea is the same. Yeah, so here we have the inferior lateral, so the arteria inferior lateralis again et medialis again. You can see, so these arteries also will go and grab the edges of the bones. In case of the medial artery, you can see, so this branch will grab the condylus medialis tibia. In case of the lateral artery, so it should go and grab the head of the fibula according to our script. Yeah, so it will wind around the caput fibula, right? Okay, so and the last or you can see the third branch is the arteria media genus. So here is the medial, or you can see that this one is like more toward the centrum located, or here under the number 8 is the same schematical branch. Yeah, so this artery will go from the behind and will pierces the articular capsula of the knee joint, will go inside and will supply the content of it. Yeah, so it will supply everything inside, like ligaments, the menisci, synovial folds. And so that's it. This is the idea of this artery. And the last one, arteries suralis. Yeah, so these arteries will supply the nearest muscles. Yeah, which basically is so these muscles belong to the musculus tricepsurae, so the caput mediale and caput laterale of musculi gastrocnemi. So this is it about the topography, the gait, and the side and terminal branches of the arteria popliteal. The separate branches we will discuss in third part. But what do we need to know about this artery? Yeah, so this is the second spot where we can palpate the pulse. Yeah, so in case of some pathology, for example, we have symptoms that let us think about the blockage of the artery, like extreme pain, the pillar swollen extremity. Yeah, in case of the acute pathology or acute situation, right? Or for example, in case of some chronic ulcer, and we need to distinguish whether this one, so this ulcer is because of the arterial, because of the venous, or because of the mixed base insufficiency, and so on and so forth. Yeah, so this is the second spot where we can palpate. Yeah, so we will palpate the arteria popliteal in case of the some problems with the blood supply into the lower extremities. Yeah, so the first was the arteria femoralis, of course. Okay, so this is it, and let's continue with the third part.